Thank you. I'm going to talk a little bit about some healthcare priorities in Illinois. Last night we had detailed budget hearings on the HFS budget and clearly saw what we have been raising as a deep, deep concern about spending priorities in Illinois. We have for a number of years advocated for fully funding the most vulnerable in our population, which is the DD community, our developmentally disabled community, as well as our seniors. Those are two groups that continue to be shortchanged every year, and the excuse has always been, well, we don't have enough funding. Well, last year, the majority party and the governor chose to expand health coverage for undocumented in Illinois. The results we raised a year ago was that this was going to open the floodgate and that this was going to become a financial burden. The state at the time said no, this is going to be a couple $100 million cost, and the state could absorb that in their existing budget. That number has grown dramatically. When the governor introduced his budget just a few months ago, they were talking about a couple $100 million cost that would affect some 10,000 individuals. A month ago, they revised that number and said, no, as a state, we're going to be covering those undocumented ages 42 and older, that number had risen to 52,000 individuals to be covered. Last night in the hearing, in just a matter of a month in the hearing, they came back and revised that number now to a staggering 120,000 undocumenteds will be covered just on the age of 42 and older, with now the latest estimate cost of $1.1 billion, of which nearly $900 million is not in the budget. Clearly, this is going to be a budget buster. These costs are going to continue to skyrise as Illinois is the only state in the nation that fully covers health care for undocumenteds from age 42 and older. When they're crossing the border and they realize they have health conditions, they know there's one state to come to if you have health issues. Illinois now, because of the policies of this state of being a welcoming state, is now being inundated with every sick individual from around the country that's coming here. We shouldn't have expected anything different when you're the only country and you're the only state in the only country that has an open border for health care. Something significant has to be done. When Section 42 gets lifted in the federal level in the next couple weeks and the border is opened up even more, we're going to be so inundated in Illinois, it's going to eat up our entire health care budget, crowding out all those citizens that need this quality care that they're deserving. These programs are going to be pushed aside to be covering this group. Just this week, the mayor of Chicago urged stop sending more undocumenteds to Chicago, yet the new mayor was down here just 2 weeks ago and made it clear that they're still a welcoming city. As Chicago gets over and inundated, the concern now is that that's going to spread to other local communities across northern Illinois that are welcoming communities and what impact it's going to be on their health. Communities like Des Plaines, Champaign County, Evanston, Oak Park, Skokie, Rockford, those that have said they're also welcoming cities, are they going to get the overflow and be hit with these costs? And are they going to be coming to Illinois asking us to bail those out as well? So we are deeply concerned. We are not surprised by these numbers. We warned over and over again about this last year when they looked at expanding it, and they went ahead and did it. Last night, they also further talked about the idea of pushing legislation to further expand undocumented coverages from those ages 19 up to 42. That's going to be another, if they do that, another $400 to $500 million first-year cost to our budget that we cannot afford. So clearly, there's a difference between what we believe Illinois should be and our priorities of taking care of our citizens, our most vulnerable population, before we deal with the national problem, which should be addressed in Washington in dealing with undocumented. So thank you for allowing me to share our concerns when it comes to our priorities in health care. And let me turn it over to Senator Wilcox.